Hi, I'm Mike Dilk, and you're listening to the Relax Back UK show, the show that explores all kinds of health topics relevant to you, your family, and your friends. Each week, I talk to expert guests from a range of backgrounds to inform and entertain you. So please do join the Relax Back UK family and stay tuned.
Hi, and thank you for joining me on the Relax Back UK show. Now, there's been a lot of talk recently about the UK population being too fat.
Should we talk about 25 to 34-year-olds? 24%, which is nearly a quarter, are clinically obese. So a quarter of our 25-year-olds are clinically obese. 35% are overweight. So a total of 69% of our UK population are overweight and then obese.
Dr. Nancy Allen discusses the extent of the problem with me, but more importantly, exactly what being too fat does to us.
Where we were realizing that people with a high BMI are the ones who have the highest mortality in hospitals due to COVID infections. So the overweight ones and the obese ones were the ones who were dying the most.
Why is this happening and what we need to do about it? So please do stay tuned for a great show. Thank you. Dr. Nancy Allen is an NHS GP who worries about the population being overweight. First of all, I thanked her for taking the time to chat.
I'm delighted to be on your show today. Thank you for the invite.
Good. Well, thanks for coming. Now, there's been a recent report in the Lancet about obesity. So I guess the first sort of question stroke topic really has got to be, is there really a problem? And if there is, how bad is it? And how long has this been going on?
Well, number one, the House of Commons did a report, a very in-depth report, detailing how bad the obesity, I would call it epidemic, is in the UK. So if I start with our children, 10% of our children under the age of 5, between the age of 4 to 5, are classified as medically obese. 12% are actually overweight. These are children who are 5 years old.
Does that 12% include the 10%, or are we talking 10% plus 12% here?
10% obese, 12% overweight.
Okay.
So if you can add them together, a total of 22% overweight and obese. That's by the age of 5.
Okay, this is getting on for a quarter then.
Exactly.
So,
going into adulthood by the age of, let's say, should we talk about 25 to 34-year-olds? 24%, which is nearly a quarter, are clinically obese. So a quarter of our 25-year-olds are clinically obese. 35% are overweight. So a total of 69% of our UK population are overweight and then obese. So that's where we are. And the numbers just increase. So by the time you're over 55, 72% are in that category as well, overweight, and obese. I can break it down. But if you just look at the government's publication on the House of Commons of obesity, they've done a very in-depth document and research with evidence-based medicine of where we are. And I think it came to light during COVID, where we were realizing that people with a high BMI are the ones who have the highest mortality in hospitals due to COVID infections. So the overweight ones and the obese ones were the ones who were dying the most.
that's right. I remember that being spoken about, but it hasn't really, it's kind of gone off the radar, hasn't it?
Well, here we are, we're talking about it. And it is a very, very complex, interesting subject. And it isn't just about being obese. There's a stigma to it, but the Canadians have realized that it is a chronic, progressive illness characterized by an excessive amount of body fat. So it's chronic and relapsing and progressive. In the UK, we still don't have a register where we identify it as a chronic disease, but it is a chronic relapsing disease. And if you look at the figures, in 1993, only 15% of the UK population were obese. That figure nearly doubled by 2020, and it became 28% of the UK population were obese by 2020. So nearly doubled in a 30-year span. The question is why?
Well, I want to ask you about whys, but before we go on to that, let's look at the effect. What we're all a bit chubbier, so what? We're all a bit chubbier, a bit jollier. Does it really matter? What's the effect?
Absolutely. So if we divide the effect into three different categories, we start off with your mental health. So when you're overweight, people tend to get anxiety, depression, eating disorders, reduced quality of life. And there's a stigma with people who are overweight as well. So that's the mental health and behavioral side. Now, the third branch would be anatomically. People who are overweight get osteoarthritis prematurely. They get reflux disease, obstructive sleep apnea, incontinence, and breathing problems. And then we go into the metabolic, which is the commonest. Everybody knows about the metabolic conditions of it. A classic one would be non-alcoholic fatty liver disease. Then you get high blood pressure, cardiovascular disease, type 2 diabetes, cancer, gout, infertility. Infertility is a very, very common one as well. So there's a lot of complex conditions relating to obesity. So I hope that answers your question.
Yeah. So all those things. This is probably an unfair question, so I'll apologise in advance. All these things must be costing the NHS an absolute fortune. Has anyone figured out what us all being too fat is costing the NHS?
I don't know the exact figures. I have to look that up. But what we do know, the highest rates of hospital admissions are linked to obesity. We know that much, to the point the government has produced guidelines about it. And even better, in December last year, we used to have the injectable skinny jabs. I'm sure everybody's heard about them. They cost a
I've
fortune.
spoken about them on this show.
Yeah, but they were available on the NHS, but only through tier 3 and 4 clinics, which is quite hard to get access to. But now the National Institute for Clinical Excellence have produced a guidance in December, that's actually mid-December, telling government what the gold standard of practice is. And the government's actually putting its money where its mouth is. It's identified the problem. It's willing to actually invest in treating, and it will be very soon available through people's GPs. We will be accountable. We're just trying to find the funding for that. But
again, we're going to come on to what to do about it. But let's take another step back. So over the last few years, we're all getting, well, pretty much all of us getting fatter. How can this possibly be happening? Because something's changed. What is it? What is going on?
That is the £1,000,000 question. So much is going on, and it's a very, very critical question. It's not just that old accolade, eat less, exercise more. It isn't that anymore. There's a lot of complex issues. And I think we'll start off with food. So energy dense food, ultra processed foods, availability, the marketing of foods and the pricing. You'll find that the energy dense foods are quite affordable and quite cheap. So that's one factor. We're eating more.
Energy dense food. What do you mean by that? What's an energy dense food?
Comfort food. I don't want to name any fast takeaway brands, but anything, if you break down its nutritional value, what's in it? Carbs, fats. It tastes amazing. It's very addictive, very accessible. You can, press a button on an app, get delivered to your door.
Yeah, and it's also relatively cheap, isn't it? A lot of these things.
Exactly, the affordability. It's cheap. Unfortunately, it is cheap, but there's a cost to that cheapness, and it's your health. And this is where things weren't available that readily back in the 70s. Before this, the past 50 years, with this epidemic of obesity is increasing in the UK. Yeah. So that's one factor to answer your question. The second is physical inactivity.
Now, you hear this, but I don't know. Have you been to Park Run recently? I got a Park Run, or I have been to Park Run in St Albans. There are hundreds of people there. You go to the gym, it's full of people. On the telly, you watch the London Marathon. There are thousands of people running marathons. Are we really getting less active?
Well, if you think of technology, how long do our children spend on their devices? How long do we as adults spend on our devices? How long do we spend in online meetings? The technology has changed. It's changed how we function as a society, and consequently, to get from A to B, we're expending less energy. We're getting into our car, or we're taking the bus or taking the tube, wherever you are in the country. Technology has changed how we move around. So yes, it has changed compared to the 70s. There was no such thing as an online, virtual meeting. That just wasn't an option. You'd have to actually make time to go to a meeting, whether you're actually walking or taking public transport. Whereas now, things are different. Technology has changed on a global scale. It's not just in the UK. So that's a reason. Besides, if you want to go on a park run, how many times a day or how many times a week, you have to actually make an intentional effort and diarize going out to a run, as
Yeah.
opposed to back 50 years ago, walking used to be part of your day shopping. You'd have to carry your shopping bags and go to a shopping supermarket and come back again. Whereas now it's an intentional thing. We don't always have time after you've done your shopping, your housekeeping, you've done a solid day's work. Sometimes you're exhausted and things slip by your priority of, oh, have I.
Yeah, that's certainly the case. The movement was much more a part of everyday life, and it's less so now by a long way, for sure.
That's
Yeah.
another thing. Now, I'm going to come into a really, really exciting, juicy subject, which I've only become aware of in the past 12 months. It's obesogens. Now, you're going to ask, what are obesogens? Endocrine disrupting chemicals, and they are the bisphenol A, BPA, our plastics. So it's a subject we need to talk about. I need to talk about and make your listeners aware of what on earth is going on with all these BPAs and what is a BPA. So it's in plastic containers and in canned foods. Receipts, like, do you know when you get a thermal receipt? So you have to check out in one of the
Yeah, yeah.
supermarkets. Do you want your receipt? BPA, you can get contaminated with BPA through a thermal receipt,
Okay. What, through your skin?
through your skin. So
Really?
the
I thought skin
question
was quite good at keeping stuff out. It's a barrier.
well, it does. I never knew this. So I think twice now if I'm actually going to get that receipt out. The question is, what does this BPA do to your body? How does it make you fat? So how does it work? It's just intriguing. So what it does, it promotes fat cell formation. So if you get a packaged food with BPA in it, or you drink water out of a plastic bottle with BPA, it will make you fat. Just think of
So
that.
is this feeding into the whole sort of microplastics debate that's going on at the moment?
Well, it's a fact. BPA is an obesogen. It's an endocrine disrupting chemical. So if you were to get a microwave meal, put it in the microwave, you've actually consuming a chemical that will make you fat.
So take it out of the plastic first before you microwave it.
Yes, and avoid canned foods as well, because canned foods, the actual can has BPA in it as well.
Okay.
So if you're shopping, get frozen or fresh food. Try and avoid canned foods.
All right. Certainly in our household, we are looking at getting a water filter.
Brilliant,
But
because
it's not simple to find one that is small enough to take out microplastics.
I love this.
Is not easy.
Well, you get leakage of BPA through our water from the taps. So you're absolutely right. You're obviously very, very informed about this BPA thing. So
My
yes,
wife is a cancer research scientist.
well, there you go. I have to put my hand up. I haven't got one, but I'll be getting one this week. After I've just researched this, I thought, oh my God, it's in the water. Another thing, so just going back to how BPA makes you fat. So it promotes fat formation, it alters your appetite, increases inflammation and oxidative stress in your body, which again makes you fat. And have you heard of the famous gut microbiome? It's become very popular. Everybody's talking about the gut microbiome.
Yeah.
It affects your gut microbiome, and it just affects, believe it or not, your epigenetics. So
Epigenetics.
epigenetics. So children in utero, if they get exposed to BPA, they then have a higher predisposition to becoming obese as well.
Okay.
So my
Goodness me.
advice is avoid plastic containers, use glass or stainless steel for food storage and drinking bottles. We talked about canned food. We talked about minimizing handling receipts, thermal paper, because they contain BPA. Filter drinking water, which you mentioned, Mike, and do not microwave plastic containers.
All right. Now, there's a couple of other things. I know some medications that we all use might have some side effects.
Yes, absolutely. What I tell my patients when I prescribe something, I'll be very honest and upfront. I'll tell them, if you want this, I'll prescribe it, but I want to make you aware this causes weight gain.
Okay. Which drugs in particular, or as an example, that might do this?
I'd rather not name drugs because sometimes people need this medication, whether and they can't help it. They have to have it. And I don't want people to go out and start panicking and going back to their GPs. But what I would say is that if your GP has to prescribe, or your doctor, your hospital consultant has to prescribe something, do ask the question, does this cause weight gain?
Right.
There's
Okay.
a lot of prescribed medications, antidepressants, antipsychotics, insulin, steroids, sulfonylureas, just generally cause weight gain. It's really worth asking. And if there are swaps that the doctor can make that are less obesogenic, that cause less weight gain.
All right. Now, you mentioned the gut health microbiome
Yes,
earlier,
yes.
and how that can get changed with microplastics and what have you. There are probably some drugs that can do the same, because I know antibiotics can wipe out your gut microbiome. Is there a link going on there with
Yes,
obesity?
absolutely. Certain antibiotics will wipe out the bacteria in your gut, the healthy ones, and they somehow promote the ones that will cause obesity. So you're absolutely right. Certain antibiotics will kill the healthy bacteria in your gut and will promote weight gain. Absolutely. So antibiotics is something to be very mindful of. A lot of my patients, unfortunately, come in and thinking, oh, I've got a sore throat and antibiotics is the answer. And it's such an effort to educate people and tell them, it's viral or it's not necessary yet or whatever. And there's another contributing factor, excessive use of antibiotics, not only resistance, but makes you overweight and fat and really messes up your gut microbiome.
Goodness me. All right. So we've got a massive problem. We discussed that. We've discussed some of the causes. So, right, come the revolution then, Nancy, when you're in charge, and you can do whatever you want to fix this, what are you going to do?
Before we go into that question, can I just add in two other things that make people
Please
overweight?
do. Yeah.
Lack of sleep.
Okay.
Your sleep is so important. Sticking to a good circadian rhythm is so important because there is a neurogastric axis. And if you're sleep deprived, we don't know exactly what the complexity is in detail, but if you're sleep deprived, you start gaining weight. So
Really?
I would
Okay.
say to your listeners, track your sleep. Try and get a good 7 to 8 hours uninterrupted sleep. It's difficult if you've got young children. I get it. I was a mum myself, having two young kids. But if you can, tracking your sleep is really, really, keeping a good sleep diary is so important. If you want to stay slim and have a good health span, you need to track your sleep. And the final one before what to do, I want to talk about stress. Stress is a very, very common factor in our daily life. And I think
Mhm.
it's so important to be mindful of managing your stress.
Does stress directly cause obesity, or is Is it if you are stressed, you're more likely to eat junk food? What's going on there?
Absolutely. So there's stress increases your cortisol. And then that's one factor. Cortisol will cause weight gain. Stress will make you want to eat junk food. And then junk food, you're talking about ultra processed food, and you'll find they have there's a lot of hidden sugars in that, and that becomes more addictive. So it's a vicious circle. So it's very, very important to manage your stress levels. If you're feeling stressed, go back to the boardroom and think, what's causing this stress? Is it a bad relationship? Is it your boss at work? Is there something you can do about it? There are things you can't change in life. We do lead a stressful life, but I actually really advocate walking. Walking is such a great de-stressor mentally. If you can walk, that helps. Being mindful eating, meditation. There's loads of meditations online that are free. And also just being mindful, diarizing, keeping a diary, gratitude journal, being a bit more positive about things helps manage your stress. So these are all the factors, the 7 factors we mentioned that cause an increase in your stress, in your weight gain in our society, and hence over the past 50 years, our obesity levels have just become 3/4 of the UK society now are overweight and obese between the two, and that's shocking. Only 1 in 4 has a healthy BMI.
It is shocking. Yeah, absolutely. There's no other word for it, really.
No.
Okay, so we are where we are. How are we
Absolutely.
going to fix it?
I love that question. So I've got, if your listeners have a pen and paper, they can do some things today to change that. So the first thing I would say is reevaluate your shopping trolley. You're out shopping. I believe in that thing where the saying, you are what you eat. So when you go out, think about plastic containers and canned foods. Think about reducing ultra processed foods. Now, what's wrong with ultra processed foods? I'll tell you what's wrong. It's got refined sugars. Refined sugars irritate your gut. Energy dense. You're having carbs you don't actually need. I can go into that, but let's say you're feeling I've heard this online, and it's a lovely way of illustrating it. You're filling your tank on your car with petrol. Normally when it's full, you get a click, don't you? And you know when it clicks, you stop and you pull the petrol hose out, don't you? Just put it back. And that's it, the tank's full. But in our body, we don't actually get a click that says, oh, you're full. Because food is manufactured to taste so tasty. Nutritionally, it hasn't got much in it, but you just eat and comfort eat. And sometimes you're watching something on the telly and you're eating whatever, and you're not mindful eating. And that click when you're full doesn't actually tell your body when to stop, and you just continue to do that. So you need to be mindful what you put in your shopping trolleys, because it's in the house, you're going to eat it. So the first thing is when you're out shopping, do that. And try and start incorporating high fiber food and avoid, like I said, the ultra processed food. Try and avoid buying food that you know you're just going to end up eating that
Okay.
isn't good for you. And just think, what is it doing for me nutritionally? That's the question before you put it in your trolley, and think, and just ask yourself that question. The second thing to do is avoid obesogenics. And we talked about BPA, so have a good think about that. Track your sleep, improve your circadian rhythm, reduce your stress. And there's a fantastic NHS app that's free. Not many people know about it. If you've got a smartphone, you can download it just this very instant. So you go on your app. It's called the 12-week NHS weight loss program. And I've actually downloaded it myself, and it will ask you what your weight is and what your height is. It will calculate your body mass index, And it's a free thing that the government's made for everybody to use, and it will follow, and it has your, you will track what you have for breakfast, lunch, and dinner, and what snacks you have, and also your exercising as well. You can input all of that and become more mindful of the kind of food you're eating. So if you start tracking what you consume and what exercise you have every day, once you measure it, you can start modifying it. So that's
Yep.
important. So you can do that today. And then let's be more mindful of the gut microbiome. It's a thing. I mean, up until about a year ago, I wasn't really aware of the gut microbiome, but your gut is it's an organ, and it's directly linked neurologically to your brain. It's hormonally to your brain, so that it's a thing you've got to be very mindful of. So improving your gut microbiome by increasing your fiber intake.
Okay. There's all kind of things you can buy, fancy yogurts and all this kind of stuff.
Well,
You're
not
going to mess around with
necessarily.
those?
Chia seeds and flax seeds. There's loads of recipes. I don't know, there's chia seed pudding or whatever. There's low carb, but incorporating chia seeds and just having them in some form or another would be really helpful. I can give you a quick recipe that I do. I get coconut milk with 2 tablespoons of chia seeds, a drop of vanilla, no sugars in that, hardly any carbs, and I just have that, and that improves my gut microbiome. I love adding cinnamon into my coffee, and that again is a very gut friendly spice that helps improve your gut microbiome. Green tea is a polyphenol rich food as well. Drink berries, dark chocolate helps your gut microbiome. So all of that really helps you reduce your weight. And then ask your doctor before they prescribe anything, if you have to have a prescription medication, what it will do to your weight. And
Okay.
then, of
But,
course, last but not least, walk. I mean, people say to me, I'll have a conversation with them and say, right, I'm going to join the gym. I say, you don't need to spend money to join the gym. Just walk every day. Try and get 10,000 steps a day. And I believe in tracking, because once you can track something, you can measure it, and then it just becomes habit. I think they say it takes 8 weeks to create a habit. So, but once you're used to walking 10,000 steps a day and just expending, it's hard when you start off with, because, as a doctor myself, I'll be in surgery for 10 hours a day. How will I get 10,000 steps when I'm sat consulting at a desk for 10 hours a day? It's hard work. So I will actually get up early and I will try and do a walk. I'll try and get 7,000 steps, and I'll try and get 3,000 steps in my lunch break. So that's my 10 a day.
good. So, at the start of the chat, you mentioned skinny jabs.
Yes.
Now, are those useful for everybody? Can they get us out of this problem? Can they save the NHS millions and billions with all these other things you were talking about? What's the situation
Sure.
with them just now?
Can I just take a moment to thank the NHS? I mean, I know we're not perfect. The NHS isn't perfect, but do you know what? For a government to actually spend that amount of money on its population to help improve its health is amazing. I don't know any other country in the world that would do that. And it's actually put its money where its mouth is. It's
Well,
actually,
I think the way to look at it is if they get people thinner, it's going to save the NHS so much money further down the line. Well, not that much further down the line.
I think that's a strategy, and they're actually implementing it. We're trying to get the resources to do it, but back to your question, your point about, yes, it does. I've seen amazing weight loss. If patients are eligible and it is safe for them to have it, then it is a very, very effective and powerful medication.
So
And
do it via your GP. Don't just buy them online from who knows where.
that's very, very important advice, yes, because there's a lot of fake meds out there. and people have jumped on the bandwagon, and people think that if I can get it cheaper, save 10 or 20 pounds, but no, they're doing themselves a big disservice. And obviously it's been in the media recently, all over, fake, people being hospitalized due to fake meds or having it inappropriately. Not everybody can have it. It's a very powerful drug, injectable medication. It needs to be respected. There's rules and regulations in having it, but if they're respected, the actual weight loss and health benefit gains is phenomenal. And I've seen people lose a stone of weight. I'm talking body fat. People who wouldn't have dreamt of being able to lose that weight, particularly disabled people or people who have issues with their mobility, or people who just struggle, or hormonal issues, and they've achieved remarkable weight loss. It's phenomenal.
Okay, all right. So that's definitely one potential way forward. If you're worried, go and chat to your GP. Just in general terms, there's an awful lot of discussion about digital health, which can mean all sorts of things. Now, I've got a running watch, which I often wear, and an exercise watch, which means when I exercise, I kind of look to see how much weight, well, not how much, how many calories I've burnt, that sort of thing. And you can see doctors online, digitally. Is this all this a good thing? Is this going to help, or does it, in the scheme of things, not really make that much difference? The whole world of digital health.
Well, it's happening whether you jump on the bandwagon or not. It's here to stay. And I think it's really good to track, because how can you change anything unless you actually measure it and track it? So how will you get your 10,000 steps unless you know how many steps you've taken? And before I started wearing a smartwatch, I was shocked when I realized, oh my God, I've only done 3,000 steps today. And so digital health, I think, is a fantastic thing. You can measure your sleep, you can measure how much exercise. I think the government recommends you do 150 minutes of exercise a week. And it's a good benchmark to measure your improvement. I mean, how do you sort of make progress unless you start measuring it? So I think measuring it is a good way forwards. And I think digital health is a fantastic platform to start measuring and improving your health.
Okay, good. Right, look, thank you so much for chatting about this stuff. This is vitally important. If people have been listening to this and saying, right, I want to find out about the sorts of things that are, or how I should change my lifestyle to lose some weight, or any of the things we've spoken about, where can people go for really good, sensible advice and resources?
I think go to start off, which is a free resource, the NHS. There's loads, like downloading this app, healthy eating. There's so much information, a wealth of information that's free. You just have to access it. You can even download this app. It's amazing. The 12-week NHS weight loss program. There's loads of information out there. But even if you don't want to, just start walking, change your shopping habits, think about what you're eating. Don't eat when you're watching TV, reduce your processed foods. It's just basic, I think, common sense.
Good. All right. Dr. Nancy Allen, so much for taking the time. Thank you very much indeed for taking the time to chat. It's much appreciated.
It's an absolute pleasure, and I hope people can start walking more and taking action and, living a better life and improving their health span.
Thank you very much to my guest on this week's show. That's Dr. Nancy Allen, a GP in the NHS, talking about obesity, the scope of the problem, the health issues it causes us, why is it happening, and what to do about it. And of course, a big thank you to you for listening, and have a healthy week. Until next week.
Thanks for listening to the Relax Back UK show. Join me, Mike Dilk, again next week for more fascinating interviews and chat. If you're listening to the podcast version, please subscribe, like, and share it with your family and friends. And have a healthy week. Until next week.